Good morning and welcome to another episode of Fertility Solutions, Fertility Talk. And today we've got Dr. Yvonne Holt, and she's from Next Bioscience. She's the Chief Medical Officer at Next Bioscience. Welcome and thank you for doing this talk with us.
Thank you so much for having me.
It's a pleasure. So, Doctor, if you don't mind just giving us a brief description or explain to us what it is that you do at Next Bioscience.
Yeah, sure. So Next Bioscience is a South African biotech company. We've been around now for 20 years in South Africa. Our laboratory is in Midrand in Johannesburg. And one of our divisions is involved with genetic testing in the reproductive space. So we work very closely with gynecologists, obstetricians, and your fertility specialists to help people fall pregnant. And in that journey, very often patients have to have genetic tests so that we can help them personalize their infertility or fertility journey.
Okay, thank you very much for that. So today we're talking about endometrial health testing. One of my first questions for you is, what role does timing play in embryo implantation? And how does endometrial receptivity testing help pinpoint the optimal window?
Okay, so the implantation window refers to a period when the uterine lining, called the endometrium, is receptive to embryo implantation. And this typically occurs 6 to 12 days after ovulation. So the egg is released, the sperm then will implant into or fertilize the egg. Yeah. The egg then travels down the fallopian tube into the uterus, and it has to implant into the endometrium, which is like a nest. Now, during this time, the endometrium undergoes specific changes due to hormone exposure in the body, making it conducive to embryo attachment. If the patient is undergoing IVF, this window typically occurs about 5 days after the patient is given progesterone. Women who have had recurrent implantation failures are more likely to have a shifted window of implantation. If the window of implantation is shifted, this indicates that the optimal time for implantation is not the typical time frame, and the embryo transfer must occur either slightly before or slightly after this time frame. So endometrial receptivity testing determines the optimal day for embryo transfer by analyzing the expression of relevant hormone-regulated genes during IVF. So it's quite complicated. Yeah. We have to see when these genes are expressing, and then we know, okay, this is the right day to put that embryo into the patient and it will implant. And by doing this, we can increase pregnancy rates, decrease miscarriage rates, and reduce the overall time to a successful pregnancy in an IVF cycle.
Wow. Thank you very much for that. Our next question is, how does the endometrial microbiome influence implantation, and what can endometrial microbiome test reveal? Tell me.
Okay, so the microbiome is, I'm sure you've all heard about microbiome. It's quite a buzzword in medical circles these days. The microbiome refers to all the bugs that live either on our skin or in our gastrointestinal tract, so in your stomach and intestines. But also we have bugs that live in our reproductive tract, and particularly so in women. And these bugs, there are good ones and there are bad ones. So reproductive tract pathogens, or these bugs, could inhibit successful implantation. And some of these bugs have been associated with what we call chronic endometritis, or infection of the uterine lining. And sometimes you don't even know that you have this infection. And but however, there are also good bugs, and an increase in a certain bacteria called lactobacillus has been known to increase the chances of successful implantation. So Next Biosciences endometrial microbiome test analyzes the endometrial microbiome to help tailor a personalized treatment strategy. The benefits obviously include the rectification of any imbalances in the endometrial microbiome, ability to eliminate any of these reproductive tract pathogens, the bad ones that are detected, leading again to a reduced time to successful pregnancy.
Okay, thank you very much. Our next question is, who should consider endometrial health testing?
So this endometrial health testing, both the endometrial receptivity testing and the microbiome testing, should be considered by women who have had multiple failed embryo implantations, women who are struggling with infertility, patients seeking peace of mind, and who just want to ensure successful embryo implantation, and also patients with recurrent implantation failure with only one remaining high quality embryo. So they really only have one chance to use an embryo. And so we need to make sure that the endometrial nest is ready to receive this embryo successfully.
Yeah. And then our last question is, what is the testing process?
Okay, so first, to initiate the process, individuals or clinics may contact us with a request for the endometrial test. It is usually the IVF doctor who will lead the patient down this path. They are the ones who will decide, what the problem is, and if they feel endometrium is a problem, they will contact us. So a biopsy is taken of the endometrium at a specific time. Now, for receptivity testing, it is done during a mock IVF cycle. So they will stimulate a pretend cycle.
Yeah.
And then they will take a piece of the endometrium. And that is done in the rooms. They insert it's like a little pincer through the cervix into the endometrium, into the uterus, and they clip off a little piece of endometrium, and they send that to us. For the microbiome testing, this is usually collected between days 15 and 25 of the natural cycle, because between days 15 and 25 is when the endometrium is at its thickest. So once the sample is collected, it is packaged with the required requisition and consent forms from the patient, and then is shipped to the laboratory for analysis.
Okay.
The results are processed, and the report is directly sent to the healthcare provider within about 14 days.
Yeah.
So you will get the results in that month. And then finally, and most importantly, these results provide the clinicians with a personalized roadmap, helping them identify the optimal timing and the environment for embryo transfer. And again, this allows us to significantly improve the likelihood of a successful pregnancy.
Thank you very much, Dr. Holt. I really appreciate that. If you don't mind, I know it's not part of our questions, but I mean, this is very interesting to me. I've never heard about this test before. So just something about it is, after how many times do you have to have a miscarriage or failed IVF before you can actually have any of these? Would your fertility specialist recommend this? Do all of them
Yes.
recommend it, or is it something that I have to go to my specialist and say, look, I really think I need to have some sort of test because of, failed IVF, multiple failed IVFs.
Sure. So, look, recurrent implantation failure is considered after, say, 2 or 3 times that they see that the embryo is not implanting.
Okay.
But you can have this on your first round.
Okay.
There are no rules really. And we're in, as I said, very close contact with all the fertility
Okay.
doctors in South Africa. They know us well. And if they feel that the endometrium is a problem,
Yeah.
they will certainly suggest it. But it never hurts for a patient to be educated
Yeah.
themselves, to know that this exists, and open the conversation with the doctor. Say, hey, I listened to this podcast. I learned about these tests that are available from Next Bio. What do you think?
Yeah.
I mean, the doctor won't be cross or anything.
Yeah.
If they feel that it is relevant, they will say, okay, sure, let's
Let's give
go
it a
for it.
try.
Or actually, in your case, that's not the problem. The problem is this.
Yes, yes.
So it's educating patients on this is to give them tools that they can go to their doctor with. These
Yeah.
days, it's not that the doctor knows best. The
Yeah.
patients are being educated and they must have the open conversations.
Awesome. Thank you very much. And how do they contact you? If they want to, if they're
So
not going through fertility specialist yet, or how do they get hold of Next Bio?
So please, I think the best way is to look on our website, www.nextbio.co.za. And they will, all our contact details are on the website,
Yeah.
and welcome to call us at any time.
Okay, thank you very much. I really appreciate having you here. It is very informative. We hope we can do another one very soon. So Next Bio
Yes.
is on our website if you guys trying to get hold of them. If you look at genetic testing, you will find all the information there. They are on across all social media platforms as well. And as you heard Dr. Holt said, you can visit their website and contact them there as well. Otherwise, DM me or email me info@fertilitysolutions.co.za and I'll gladly put you in contact with Next Bioscience. Thank you very much for taking the time to do this talk with us. I really appreciate you coming to do this. So thank you very much.
Such a pleasure.
Have a great day. Thank you.
Thank you. You
Bye.
too.